Today's technological devices are increasingly smaller, more mobile, and more data-intensive. Nowhere is this truer than with smart devices. Personal health trackers, smart assistants, and medical-grade monitoring devices are all generating massive amounts of information. In the world of healthcare, this presents an opportunity. All of this data can be leveraged by healthcare professionals to provide better, smarter, and more efficient patient care. When capturing all of this data, developers might notice that devices often follow different communication standards and generate far more data than is useful to receiving applications. These differing standards make it hard to develop applications that communicate with each other efficiently and send information to the people who need it. InterSystems IRIS for Health streamlines this process by providing a central integration engine that allows you to integrate, transform, and interoperate among multiple data applications, programming languages, and communication standards. Using InterSystems IRIS for Health, each device can connect to the interface using the most suitable programming language and communication protocol. For example, you could have an MQTT broker in C#, host an Alexa or Google Home skill in Python, or receive FHIR and HL7 messages directly from upstream applications. All of these devices connect to a single InterSystems IRIS for Health application to route, transform, and send data to downstream applications. This process allows developers to separate the connection logic from the decision logic, enabling faster development. It also means less debugging and fewer delays from industry-specific communication protocols or specific connection requirements. Designers can create interfaces in a low-code, graphical user interface that applies business rules to decide where these messages go and what data format they will be transformed into. Let's take a look at some examples in which device data can be used in a healthcare setting. A hospital might use an oximeter device that monitors oxygen levels in newborn babies. The oximeter connects to a smart device over Bluetooth, which sends FHIR data to InterSystems IRIS for Health. The message can then be analyzed for early warning signs of a congenital health defect, and then directed to the most appropriate application or provider according to the infant's risk level. If needed, the message can be transformed to HL7 from FHIR before being sent downstream. Another example is using smart assistants such as Alexa or Google Home to automate daily medical questionnaires for patients in need of ongoing monitoring.
On a scale of 1 to 10, how much pain are you in?
This smart assistant can send a message through InterSystems IRIS for Health into a business logic interface. The interface integrates this data into a report that can be reviewed by the patient's physician during a regular visit. However, if the patient suddenly spiked to a very high level, it would be instantly passed on to the physician, who can look into other factors causing this pain. Questionnaires like these could better connect patients to their providers and assist providers in effectively monitoring patients with chronic diseases. All of this device data can also be stored in a central database and used for analytics, dashboards, and customizable reports, available on the same platform. By supplying these adapters, built-in data transformations, and decision logic, InterSystems IRIS for Health enables developers to focus on developing innovative solutions to their unique problems, rather than writing repetitive connections between individual devices and applications. With InterSystems IRIS for Health, your applications can receive the information they need from a variety of devices, enabling your providers to gather patient information from a number of sources and offer patients the best care possible.